Hello everyone, welcome to Raw Online. I am Dr. Abhinaya, I am a consultant pediatrician. In Nielsen-based pediatrics teaching, the chapter that I am going to discuss now is the chapter on anaphylaxis, a very important topic both from the exam point of view and from a clinical point of view. So let's get started. So first, what is anaphylaxis? Anaphylaxis is a very serious allergic reaction. It has got a very rapid onset and may cause death. So it is the most serious allergic reaction that we may come across. Why it occurs? There is a sudden release of many biological active mediators, mast cells and basophils predominantly whenever an allergenic trigger occurs. So the causes can be multiple. We will deal with them in detail. So what are the causes of anaphylaxis and where does anaphylaxis occur? So anaphylaxis can occur either in the hospital setting or in the household or the outside setting. So if it occurs in the hospital, it may be due to drugs that we administer, either oral, intravenous infusions or IM injections, sometimes vaccines also. And the other important cause of anaphylaxis in a hospital setting will be the latex allergy. Say a patient is undergoing a surgery and in the perioperative period, a patient goes in for an anaphylactic reaction, latex allergy should definitely be suspected. Anaphylaxis can also occur outside hospital and most commonly food, and among the food, peanut is the most common allergen which is triggering the anaphylaxis. Children with latex allergy can have food allergies to other fruits like banana, kiwi, avocado and nuts like chestnut and passion fruit. So this is cross reactivity. So latex allergens can have cross reactivity to certain fruits. So in case if you find that the child has a latex allergy, we should also counsel the parents regarding the cross reactivity to the allergens which are present in these fruits. So whenever the child takes banana, kiwi or avocado, better not to take, tell them to avoid. In case the child takes accidentally, they have to rush to the hospital to prevent the anaphylactic attack that can follow. So coming to the pathogenesis of anaphylaxis, so there are multiple mechanisms that have been implicated. It can be immunologic, it can be non-immunologic and other immunological mechanisms apart from the IgE mediated hypersensitivity reaction. So coming to the first column. So in this, it is IgE mediated hypersensitivity reaction in the following triggers. Say there is an insect bite. A child has taken a food like a peanut or cow's milk or egg or any nut allergy. Medications like beta-lactam antibiotics most commonly and any other sometimes like a latex allergy. So all these are mediated through IgE hypersensitivity reaction. Other immunological reactions, it can take place due to type 2 cytotoxic reactions. It can happen due to complement system activation or autoimmune mechanisms. Sometimes there is no immunological mediated mechanism but it is completely non-immunological. Say a child or a patient has undergone an exercise, doing an exercise and then he takes food. Immediately the patient can go for an anaphylactic attack. This is a completely a non-immunological mechanism. So exposure to cold, certain medications like opioids are all triggering the anaphylaxis through non-immunological mechanism. The key cells are two, mast cells and basophils for anaphylaxis. So once the mast cells and basophils are degranulated, multiple inflammatory mediators are released. Very commonly we should know histamine, tryptase, chymase, prostaglandins, leukotrienes, etc. The target organs in anaphylaxis will be first skin. The first most common symptom will occur in the skin mostly, but sometimes without urticaria also the patient can present to us with anaphylaxis. So that is a very difficult and a very tricky condition to diagnose. So the first target organ will be skin. The patient complains of itching, sudden flushing, warmth. Sometimes they can have fever due to diffuse warmth, hives, diffuse urticarial reaction. Severe form will be angioedema. Next target organ will be respiratory. So the patient can have cough, difficulty to breathe, that is dyspnea, hoarseness of voice, stridor or wheeze. Next target organ will be GIT. The patient can present to us with nausea, vomiting, diarrhea and severe abdominal pain. CVS and CNS can also be affected. If the CVS is affected, the patient complains of dizziness, hypotension, present to us with anaphylactic shock, a diffuse vasodilatory shock and incontinence. CNS affected will present to us with headache. So, this is a very simple picture wherein you can know what are the mechanisms of anaphylaxis, what are the key mediators in anaphylaxis and what are the target organs and the symptoms, the target organs and the symptoms if a particular target organ is attacked.